What if after a heart attack your doctor prescribed a statin and a shopping list? Not just medication to reduce your risk, but real food, real guidance, and a plan to help your body heal alongside the pill. Because the truth is both matter, and both should be part of standard of care. In this video, I'm going to walk you through what would actually happen if doctors prescribed a plant-based diet after a heart attack, not instead of medication, but right alongside with it where it belongs, just like we prescribe cardiac rehab. We're going to look at what the science says, what this could look like in real life, and why it still is not the norm. I'm going to share a real story of how I've done this in practice. So I'm Dr. Jan, I'm a lifestyle medicine doctor. I am passionate about helping people use sustainable steps to reverse and treat chronic disease, but really reverse is where the power is. And with the use of lifestyle medicine, we can go beyond managing disease to actually making lifelong change, life-extending change. So several years back, a close friend of mine had bypass surgery, quadruple bypass in fact. And when I went to visit, I was shocked that the first postoperative meal was standard American meat and potatoes with a little side salad. So there was little green veggies. But I didn't understand. This was in the beginning of my career as a lifestyle medicine. I've been an ICU doctor for years, but I was starting to learn about the power of nutrition, and I didn't understand how these two were not connected. So I actually went home and I made food and brought it to the hospital. Whole foods, plant predominant foods. And after my friend was discharged, I worked with them to adopt a more plant heavy diet, and that really has been a life-changing. And with my own patients, I do this every day. I work with them to create nutritious, flavorful, enjoyable meals, but also at reducing stress, finding sustainable ways to move every day, optimizing their sleep, strengthening social support networks, and then working on reducing or avoiding risky substances. And this is life-changing care. It actually, in many cases, can be disease reversing. I have had patients that have been able to come down off of medications and seen improvement in not only their cholesterol, but lower inflammation, lower A1C. It really does make a difference. We have decades of data showing that nutrition impacts heart disease. In controlled programs that have been led by Dean Ornish and Caldwell Esselstyn, to name a few, comprehensive lifestyle changes have been employed and shown that they can actually reverse plaque. When we use whole food, plant-based nutrition, we see improvements in cholesterol, reduced angina symptoms, lower blood pressure, and again, in some cases have shown regression of plaque buildup. This is not in place of medication, it is an addition. And just as medication can treat the biological pathways, nutrition treats the whole person and addresses the root cause that often remain untouched when we slowly employ medication and technology. So I'm going to paint a vision. Imagine after a heart attack, every single patient was discharged with both prescriptions and a referral to a lifestyle medicine team. They get a clear, practical support, and they get evidence-based, meals, movement, sleep, and stress management techniques. Not vague advice, not fear-mongering, but an actual plan. They learn to prepare meals that are satisfying, culturally familiar, and based on whole plant predominant ingredients. They start walking daily, sleeping more consistently, and feeling their energy return. And over time, not only do their labs improve, but their disease begins to reverse and their confidence improves. So why doesn't this happen? Why isn't this standard of care? The thing is, medical education in most cases still just barely touches on nutrition. And unfortunately, our system is heavily procedure and medication based, and it's focused more on managing rather than preventing disease. The other thing is comprehensive care does take time. It is hard to bill for, but it is really important that you don't have to wait for the system to catch up. So if you or somebody you love have had a heart attack, or you've been diagnosed, or maybe you're at risk, this is your moment. Yes, medication absolutely plays a role, but so does every meal, every walk, every hour of rest. If you want to learn more, I recommend starting with the documentary Forks Over Knives. It was life-changing for me. I will tell you, when I became plant-based and when I watched this movie, it literally changed the course of my career. Or there's also books like Preventing and Reversing Heart Disease by Caldwell Esselstyn, and so many other books. If you want more recommendations, I'm happy to send them your way. Just comment below. If you're looking for personalized guidance, I offer one-on-one support. You can book a discovery call using the link below. We'll talk about where you are, what is possible, and how lifestyle medicine can really support your recovery, maybe prevent disease, and even in some cases reverse disease. You do not have to do this alone, and you don't have to wait for things to get worse before you take the first step.